Madinah Institute for Leadership and Entrepreneurship, MILE.
All right, thank you very much, and thanks to all of you who have come into this session. I'm looking forward to our time together, and we're going to be talking about how to diagnose and improve your organization's health. And we'll start with a basic question: what is an organization? We know it's not just a bunch of people who gather together, as we're seeing here on the screen. I mean, this could be a group of people at a sports event or anything. But an organization requires structure. And we're going to look at the structure of an organization and how we might assess the health of this organization utilizing three different structural parts. And the first one is top leadership, the second one is managers and supervisors, and the third is workforce. This is pretty standard. We know that organizations have all different levels of complexity and different levels of hierarchy, but it's helpful to break it into these three different parts so that we can begin to assess where our organization is healthy and where perhaps it may be unhealthy. And when it works, when all the different parts are in place, we're happy. It works. We're pleased. And so especially the top leader, because they want to see the organization go forward and they want to see the organization running smoothly. But I think we're all aware that this does not always happen. And sometimes you have the top leader going one direction, you have the workforce going another direction, your manager, supervisors even still perhaps another direction, and all of this non-alignment leads to a whole lot of confusion. It leads to some issues in terms of communication, and ultimately an unhealthy work environment to where our reaction is a little bit more like this picture on the screen. It drives us crazy. Why doesn't the organization work? And what we're going to explore today is how we can begin to piece together an organization that is healthy, that is strong, that communicates, that builds leadership throughout the organization, that allows for creativity and risk-taking. So let's explore this. What makes an organization healthy? Well, what does it mean to be healthy? And for this definition, I'd like to take us to the World Health Organization, and here is their definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Well, let's explore this definition. I think it's a powerful definition because it suggests that health is a set of positive characteristics, not just the absence of sickness, not just the absence of disease or infirmity. And so we see there's a physical dimension to health. There's a social dimension to health, relationships. There's a mental dimension to health, how we think, what our values and attitudes are. So if we can put together this definition of health and apply it to organizational life, that's going to help us to move towards our goal of building healthy organizations. So I'm going to suggest to you here first, the first part of our presentation, that there are 6 building blocks for healthy organizations. And by the way, this came out of a research project that I conducted back in the late 1990s in my dissertation work, and the whole process was to try to define operationally the concept of servant leadership and how servant leadership can help to build healthy organizations. And in the process of this research, we discovered these 6 building blocks. Each of the building blocks has 3 descriptors, and these descriptors become the basis of the organizational leadership assessment. Let's explore this, these building blocks together. The first one is that healthy organizations display authenticity. And you can think of all the words that sort of mean the same thing as authenticity: integrity, transparency, honesty. And here are the 3 descriptors here on your screen. Healthy organizations display authenticity by being open and accountable to others. And we're talking here of the leadership. We're also talking about the managers, and we're also talking about the workforce, those three segments of organizations we already saw. Also by a willingness to learn from others from all directions. We display authenticity also by maintaining integrity and trust, or being trustworthy. So a healthy organization is a trustworthy organization, willing to be accountable, willing to be open and transparent, willing to learn from others. Also, healthy organizations value people. And the opposite of this, of course, is organizations that use people for their own means. And we're all familiar with organizations that are unhealthy, who abuse their people to get what they want out of them and then toss them away and bring in someone new. But healthy organizations truly value their people. And here are the three descriptors: by believing and trusting in people. Leaders of healthy organizations, servant leaders, really believe in their people. They trust their people. They give trust to their people. The second descriptor, by serving others' needs before your own needs, which is probably central to the whole concept of what servant leadership is all about. I serve the followers, I serve the other, so that their needs can be met ahead of my own needs as the top leader of the organization. And the third descriptor, by receptive, non-judgmental listening. I think we're all familiar with the type of listening where someone is hearing part of what we say but are preparing their arguments and in fact talking over us before we even finish what we're saying. But people who value other people commit to listen to them. They're receptive in their listening. They're non-judgmental. They're willing to hear what the other person has to say. And this is one of the things, one of the most critical things that communicates value to another person. So we've seen two of these, display authenticity and value people, but I'd like to explore this one element of trusting people by asking you a question. And I know you're not going to respond at this point, but I want you to go ahead and respond by yourself to this poll question here. There are two questions, and you need to select either A or B. Okay, you can't select both. You can't say, well, I want part of one and part of another. You can select A or B. A is, trust is something that people must earn. Okay. B, trust is something that should be given as a gift. All right, take a moment to think through that and go ahead and make your selection. Write it down maybe to make a commitment. Do you select A or B? And I'll go ahead and give you some of the responses, as I've done this question in leadership courses in a master's level, undergraduate level, done it in presentations to many different organizations. What we find is that people are fairly split on this. Most people select A. Trust is something that people must earn, because that just seems to make sense to us. You know, people have to earn trust, and you can, if you violate trust, it's hard to earn it back. It's hard to get it back. But some people select B. Trust is something that should be given as a gift. And I would like to suggest to you that in healthy organizations, leaders from a servant mindset are willing to give trust to their followers, and they give it as a gift even before it's earned. And think about this for a second, because your first thought might be, well, people could violate that, people could walk all over you, people could violate that trust, and yes, that's true. But think about someone who trusted in you, believed in you at an early stage of your own leadership development, even before you had earned that trust. What did that trust given as a gift do for you? I know this happened to me, people that believed in me and shared that belief in me, and what it did is it encouraged me to reach out, to reach toward my potential, to try to live up to the belief that they had in me. And so healthy organizations really build trust, and they do it by giving it as a gift. Here's the third area. Healthy organizations develop people by providing opportunities for learning and growth, by modeling appropriate behavior from the leadership, and building up others through encouragement and affirmation. So healthy organizations are not, again, just going to use people up And if you're not fitting their scheme, toss you away. But healthy organizations are going to be committed to their employees. They're going to be committed to developing them, to identify their gifts, to do job fit analysis so they can put people in the best positions so that they can reach their potential. Yes, they provide training. They provide development opportunities. And they're willing to just have a learning spirit within the organization. We're a learning organization. We're here committed to growth and development. So far we've seen 3 of our 6 areas: display authenticity, value people, develop people. And I hope you're seeing that these are not just kind of nice characteristics, but they require that we change the way we think and act towards those that we lead in our organizations. Let's look at the 4th one. Healthy organizations build community. And this is not the area of serving the community outside the organization. This is about building community within the organization by building strong personal relationships, working collaboratively with others versus competitively, and valuing the differences of others. So this is the whole area of diversity and celebrating differences and gaining the strength that comes from differences. And it's also the whole area of commitment to partnership, commitment to working with others, not working in silos, not separating our teams and competing for scarce resources. And to illustrate that, I want to share a little bit of a story with you here, and you may or may not recognize this picture of who this is, but you'll probably recognize this picture. Yeah, that's Nelson Mandela, and the earlier picture, the one on the left, is when he was younger as an attorney serving in South Africa, working for the African National Congress. And you're familiar with the fact that under the regime of apartheid that Nelson Mandela was put into prison for 27 years. Here's a picture of Robben Island Prison, where he lived 27 years of his life. He was finally released at the age of 71. Pretty amazing. Imagine your own reaction to having 27 years of your life pulled away from you, your professional life, your personal life, and being imprisoned for this period of time. Well, how did Nelson Mandela respond? Well, here's him giving a speech just after being released from prison, and he made this statement: "As I walked out the door toward the gate that would lead to my freedom, I knew if I didn't leave my bitterness and hatred behind, I'd still be in prison." And so Nelson Mandela first led himself. He worked on his own emotions, his own reactions, his own feelings, so that he could become a leader and lead his people. And we know that that produced the opportunity where he became president. And he eventually won the Nobel Peace Prize in 1993. What many people don't know is that Nelson Mandela did not win this prize alone. He shared the prize with Frederick Willem de Klerk, who was the president of South Africa during the time that Nelson Mandela was in prison and was released. So these two men were, by most considerations, enemies. They were on opposite ends of the political spectrum, opposite ends of the racial spectrum, and yet they partnered together to build a new South Africa, and together won the Nobel Peace Prize. A wonderful example of working in partnership, building community across diversity, across boundaries. Or healthy organizations also provide leadership by envisioning the future, vision, by taking initiative or action. Leaders have a bias for action, and by clarifying goals, mobilization. Healthy organizations are well led. They're given direction from the leaders. Their leaders are clear about the vision, the direction of the organization, and they help people to move forward. But we add the 6th item, which is critical, that healthy organizations share leadership by facilitating a shared vision, sharing power and releasing control, letting others lead, and sharing status and promoting others. So we have these 6 areas that identify healthy organizations. They display authenticity, value people, develop people, build community, provide leadership, and share leadership. Okay? So what do we do with this? Now we've worked with this in assessing organizations, and we found that organizations fall into different health levels. Ultimately there are 6, but we're going to focus on 4 of these here today and illustrate these for you. And basically it's the presence or absence, the level of presence or absence of these 6 characteristics that we've just learned applied to the organization and practiced by the organization. So with these 6 levels, we're going to see at the bottom, Org 1 and 2, poor to toxic organizational health. Then in Org 3 is limited organizational health, still kind of poor, not that strong. We're going to look at the details of this. Then we get up to an Org 4, which is moderate to good organizational health. And then ultimately where we would love to be, and research shows that this type of organization are very successful in building trust and team effectiveness and so forth. This is an Org 5 and 6, excellent organizational health. And I think you'll see on the left-hand side that our picture of the organizational structure changes and shifts as we go through each of these organizational health levels. Let's explore them one at a time. The first one is toxic leadership. Take a look at this picture, and what do you see? We have the leader, large leader, looking down at the followers, pointed finger. This is an Org 1 and 2. We call it toxic because it's a very unhealthy organizational structure. And here's the picture of it. The top leader is the largest, the top dog. Usually it's one leader. There are middle managers. You see the arrows pointed down. The authority goes down from the top leader to the managers to the workforce. This is an autocratic approach to leadership. Autocratic in its basic meaning means leading for self, leading for a leader that leads for themselves. It's an organization of high fear. In this type of organization, people are afraid. They want to stay below the radar. They don't want to put their head on the chopping block. And so you have low trust. They're not trusting of the leader, of the managers, of the organization. So therefore, they don't take risks. And they're not willing to express creativity because that takes a risk. Someone may call you for that, may call you down for it. So there's poor communication. People are afraid to communicate in this organization. So that's just a few of the characteristics of very unhealthy organizational structure. Now you think about what's happening and what philosophy is driving this, and we go back to Machiavelli, and here's some of the principles that he developed way back in Italy centuries ago in his famous book, The Prince. And he said leaders should protect themselves at all costs. They should speak just enough truth to give the appearance of being trustworthy. Don't let anyone take advantage of you as the leader. You're the top person. You're the most important person, according to Machiavelli. Maintain total control over the situation. And remember, this is his famous quote, it's better to be feared than to be loved. So he would welcome the Org 1 and 2 because fear to Machiavelli is a good thing. It keeps people under control. It makes people comply with the wishes of the leader. And this to Machiavelli is good. But we're finding more and more that this type of fear-oriented organization not only is dangerous for the workers, but it's ineffective for the organization. It's unhealthy, and it leads to bad outcomes. Here's a couple ways that people could be unhealthy leaders. One is narcissistic. And you think about narcissistic personalities. Unfortunately, a lot of times these types of personalities go towards leadership. These are leaders that are self-absorbed. They're about themselves first and foremost. They lack empathy for others. They have a high need for admiration and seek admiration from others. They exploit others for their own purposes. And they have a deep sense of personal entitlement. And you can see the danger of having a leader who is this self-absorbed, this focused. Here's another type of toxic leader, addictive leadership. This is a person who is obsessed with the focus of their addiction. That addiction might be alcohol and drugs, it might be power, it might be sex, it might be anything that becomes an obsession to them that would take away from their ability to serve others. They are manipulative. They isolate themselves. They withdraw from relationships. They're very good at lying and deceiving others, and they ultimately have low self-esteem, though you don't see this at first glance. What if we could measure to see if an organization is unhealthy, is a level 1 or 2 organization? The Organizational Leadership Assessment was developed. It's a 60-item assessment that measures the 6 areas that we discussed. It's completed by top leaders, managers, and workforce within an organization, and then the results are displayed graphically. Let's take a look at what one of the pages would look like in this report. This is the perception match page. Now I'll give you a little bit of information of how to read this. You'll see on the left-hand side, the vertical side, the 6 areas that we discussed: value people, develop people, build community, display authenticity, provide leadership, and share leadership. Across the top, horizontally, you'll see the 6 organizational health levels, and we've been talking about toxic health, Org 1 and 2. Now the 3 bars are the 3 different sections of organizations. The red bar is top leaders, the green bar, managers, supervisors, and the blue bar is the workforce. And a couple things you'll see right away is the blue bar is a whole lot lower in their analysis of, valuing people, for instance, the very first one. Top leaders see it up there at an Org 4, managers at an Org 3, the workforce in an Org 2. And then the perception gap becomes even wider when we look at developing people. Look at the difference between the top leaders in developing people, see it as an Org 5, and the workers in an Org 2. What do you think is happening in this organization? What do you think is going on? What are the dynamics? Can these groups communicate with each other, top leaders, managers, and workforce? Yes, there's a lot of breaks in communication, issues of creativity and risk-taking. Here's job satisfaction. Top leaders way high, managers in the average, good range, and then very, very low for the workers. And here's another report. We look at readiness for change, and you can see that this particular organization, a toxic organization, has very limited readiness for change, because their power level is low, their health level is low, and their perception match is very, very high. Well, here's our next level. When we get past an Org 1 and 2, we get up to an Org 3. This we call negative parent or negative parental leadership. Take a look at this photo and what it represents. The woman is the leader, talking down to the child, okay? And what's her response? Look at her. Yeah, she's just sort of cowering and hiding, trying to hide, and yet dealing with this negative parental style. And so here's our image of that. Negative paternalistic leadership are those organizations that score in a particular range on the OLA. What we find with these organizations is that the leadership is critical. They're seen as critical, like a parent often can be critical of their children, talking down to their employees. They emphasize negative reinforcement or punishment. If you do this, then you will be punished. You'll be fired. You'll be put on a probation, whichever. It's a fear motivation. Not as much fear as in a toxic organization, but still very much a fear motivation, and a good deal of avoidance. There's really a parent-child relationship and model where the leader takes the role of a parent, a negative parent, talking down to, you'll never amount to anything. And the children then are the employees. And the dynamic that occurs here is that if we treat our employees as children, they will tend to respond back as children. And that then reinforces our parental emphasis, and then that reinforces their childlike response. And children can respond either by being compliant or by being manipulative. And we see those types of negative behaviors in this type of organization. So this type of reinforcing negative parental model is very powerful in organizations, and in an org 3 it's a negative experience, and we need to find a way to break this cycle. We're going to give you a suggestion here in a moment how to do that. And here is the graphic presentation from the OLA report, and you can see that the blue bar here for an org 3 has moved up to the org 3 level. Top leaders, there's still pretty good perception gap. But what's interesting with this one, by the way, these are real organizations that we're presenting with these graphs. The managers are lower than the workforce. Very interesting dynamic, and points to significant issues that are present between the management team and the top leaders of the top leadership team. This gives you an opportunity to address that and begin to build a healthier organizational structure. Here's the next level of organizational health, org 4, and this is the positive parent, positive parental leadership. Take a look at the photo, and what do you see? The role of the leader is sort of nurturing, caring, supportive, kind parent, and the child is compliant child who needs the guidance of their parent. Well, let's look at the strengths and weaknesses of this level. We're obviously getting more positive. We're into moderate to good organizational health. And this is all about the leader who is nurturing, caring, supportive. Positive reinforcement is used, rewards as opposed to punishment. Fear is there, yes, but more mixed with respect. I respect my leader, and I keep my distance a little bit, but I respect them. But here's the real key. It's still a dependency. The workers are dependent upon the leader to care for them, to nurture them. The workers are not leaders themselves, but the top leadership still resides in the top leader or the top leadership team. So you still have a parent-child dynamic. It's positive at this point, which of course is much better than the org 3. It's positive paternalistic, but still you have the situation where I am nurturing you as a leader and caring for you, talking down to you, but in a kind way, but you then tend to respond back in a child role. And again, we look at compliance. This is the worker. I've heard this stated by students who said, well, I want that. I want to be cared for, and I want to be told what to do, and I want to be told when I do it right, and all of that. And yet, what this particular health level does is it reinforces compliance. It reinforces dependency instead of building leaders throughout the organization. So let's look at what this looks like. Here's the org 4, and you can see the blue line. And again, this is another organization, and you can see the perception match is closing up a bit here, and the workers see this more positively, and the managers, there's variations on their responses. So we've seen 3 so far: toxic, the negative parent, and the positive parent. Is there another way? You've seen the strengths and weaknesses of these. So let's look at the next level of organizational health. We'll call it servant partner leadership. And take a look at the photo here. What's different? Well, one, there's a whole group of people, and one question you could ask yourself is, well, who's the leader? I'm not sure you can answer that by looking at this photo, but that's significant because let's look at the dynamics of a servant partner leadership organization, an org 5 and org 6. First, take a look closely at what's on your screen, okay? Take a look at this cube and answer these questions as we go through them. Can you see the circle in the center of the front panel? Okay, take a look. Follow this along now. Can you see the circle at the bottom right of the back panel? Here's the next one. Can you see the circle at the bottom right of the front panel? Okay, this makes it a little bit harder. You got to shift your view. And can you see the circle at the center of the back panel? If you're able to follow along with this, you're able to see this box sort of shift and move. It actually moves even though this is just a two-dimensional image on a screen. Well, it didn't really move, but it can move in your mind by the differing perception. We need to change our perception of how we view leadership. That's the point. Here's the way we were looking at it before initially. Top leaders at the top, managers, supervisors, and then workforce. Here's the image of a level 5 and 6 organization. And what do you see that's different? Okay, the top leaders are now at the bottom of the organization. They now constitute a team, and there's one marked out who's the top leader, sort of a first among equals. Their role is to support. Their arrow is now pointing up to support the managers, who then support the workforce. So what's happening here is that these 6 characteristics that we described early in the presentation are present, okay? And the parent-child is not occurring. This is not a parent-child view, but there's a whole different view which we'll call adult to adult. And here's how that works. When we respond as an adult to someone else, when we, as a leader, we treat someone with the mutual respect of adults, listening to them as an adult, respecting their opinion, expecting the best from them, they will tend to respond back with adult behavior. And that is one of the key characteristics of a healthy organization, is all people see themselves as adults leading. Now here's a graphic view of the perception match in an Org 5. Look where the blue line is moved now to an Org 5 clearly. The managers, the green line, are also there. And of course the perception match is very close. And so this is a healthy organization. Good things are happening here. People feel valued. People are authentic. They're developed in this organization. There's a sense of community. Leadership is provided and shared. So you can see graphically the key difference between an Org 5 on the top left of your screen and an Org 2 that we looked at before on the bottom right of your screen. This is what we want to move towards, because this type of organization, and we've had several research studies, we've had 45 different dissertations that have been completed with the OLA that have supported that as the workforce moves up higher in this, to higher levels, Org 5 levels, that trust increases, the trust in the leaders, trust in the organization, organizational safety increases, team effectiveness increases, job satisfaction increases. So these are the things that build a healthy organization. Here's that same organization. You can see the job satisfaction of the workforce. And of course, here's the perception or the readiness for change chart, which shows they're good, up there, good readiness for change. This is an organization ready to deal with the pressures and difficulties of organizational change. So with servant leadership, we want to build these 6 characteristics throughout the organization. And that can be done. It can be done through intentional organizational development interventions that seek to get people to think differently about leadership, differently about how they relate to one another as an adult to an adult, and seek to build these qualities within the organization. Let me close off with a story here, and this has to do with an organization from Indiana in the United States that several years ago started a branch office in Atlanta. And their main office was in Indiana, quite a ways away, and Wabash, Indiana. And in the morning of November 29, 2007, Ken Rauch, who was a student of mine and also the HR director in this organization, received a call from the manager of the GNS plant in Manchester, Georgia, about 60 miles south of Atlanta. There had been an explosion in the plant, which you can see the results of here on your screen. The manager was pretty calm about it all. We think he was in shock. And Ken asked if everything was under control. He said it was. But then the call from the media came, Bloomberg News Service, wanting a comment. Well, then it got on CNN, and obviously this was a very, very big deal. 3 workers were burned in the blast and were taken to the hospital, and ultimately one of those workers died. CNN showed the damaged building on national TV. Ken called for the company plane to take a group down to Georgia to confront this situation. And his first question was, if you were an employee in this situation like our employees in Georgia, what would you need? That's a great question because he's focused on the needs of the employees. And they went there and they gathered the employees together, they talked to them, they sent them home to be with their families, invited them to come back the next day. They weren't sure if they would come back, but Ken then went and talked to the media. He decided that, as I face this, I'm going to utilize this servant leadership model that we had learned about in class, the one we have looked at today. How do I value the media? How do I value these employees? How do I display authenticity? And so as he went into this, he decided to be open and upfront and honest. At one point, the fiance of the one gentleman who was injured and was ultimately died, asked to see the location of the blast, and Ken was aware of the legal issues, but he said, no, we're going to be open, we're going to be honest. He allowed her to come into that. All of his actions were guided by this particular model that we have talked about today, and it made all of the difference because this difficult situation needed authenticity and valuing of people and developing people, building community, providing and sharing of leadership. And the ultimate result from this was that this community supported the leadership of this organization. And no lawsuits were filed. There were, of course, inspections from the government that came in, and these were all handled in a healthy, a strong way. And one of the things that Ken mentioned that I would like to share with you is that he stated that once he determined his philosophy, this particular model was in his mind and in the minds of his team, he stated it was easy, once he had settled on his basic values, to make the decisions that needed to be made. No spin, no self-protection, no needing to make false positive impression. And so he decided to serve. He decided to ask, what do you need? What would I want in this situation? And he made a statement. He says, you have one chance in situations like this to hit the right tone. And what you do comes out of what you believe and out of who you are. So I think I've come to the end of my time for presenting, and we now can go and share some questions. So I'd like to hand that back. Let me get the last slide up here. Okay.
Well, thank you very much, Dr. Laub. While you're shifting towards the next slide, let me request the attendees to please be informed that we are now open for the question and answers. If you have any questions, you could either raise your hand. There's a hand icon available on your webinar console, or you could put your question in the question box, and I'll be happy to read them over on your behalf. I see there are already a couple of hands raised, and there are questions in the box, so let me move to the callers who have raised their hand first. We have the first caller, Mr. Dhanasekaran. Mr. Dhanasekaran, could you please unmute yourself and introduce yourself and ask a question if you can hear me? Mr. Dhanasekaran, okay, yes, sir, you have unmuted yourself. Could you please introduce yourself and ask a question?
Yeah, can you hear me?
Yes, we can hear you.
Yes.
Yeah, my name is Dhanasekaran. I'm working as a senior contracts, lead contracts engineer with Qatar Petroleum in Doha. So it's I was happy to actually, this is the first time I'm participating in the webinar by this organization. I like
well, thank you very much for joining, Mr. Dhanasekaran. Do you have any questions, sir? Please feel free to ask it.
Yeah, I have a question actually. What if my boss actually, my boss always says that, okay, you issue a warning letter or verbal or oral warning letters to the subordinates. So, which though I don't like to do that, as you said, I wanted to be transparent and would like to share things with my subordinates. But my boss wants me to issue a warning letter to the subordinates, how to handle such a situations.
I caught most of that, but I didn't catch what your boss asked you to do with your employees. Could you repeat that, please?
Sir, let me repeat, sir. Mr. Duncan is asking, what about if your boss requests you to, most of the time, issues the warning letters, like the punishment strategy, rather than be more transparent? How should we tackle this?
Yeah, very challenging, of course, because it's a larger question about how can you, as a middle manager who has a boss over you directing you to utilize negative approaches, support the positive approaches that you would like to do. I think one is to certainly solidify your own value system and decide what you want to do, and then have that communication with your boss. It may be that your organizational system requires you to put people on notice, and if that's the case, you still can have that larger policy discussion with your organization, but you may be forced to comply with that. But I think you can still support your employees by saying, well, I do need to write you up on this perhaps, but let's work on an improvement plan. We're all about development here. We're not about punishment. We're about helping people to fulfill their potential. So it's a fine balance when you're not the top leader who's in the position to make the policy, but you still can live out your values even if you're forced to do some things that you would prefer to do a different way. Does that help? Okay, I'm not hearing anything right now. Are we still connected?
Yes, Mr. Danasekran, I believe, Mr. Danasekran, you have muted yourself. So if you have any supplementary, you can unmute yourself. At a later stage, you can raise your hand. But let me move to another caller who has raised his hand. We have Dr. Muhammad Rishad Faridi. Dr. Muhammad, thank you. You're a regular caller, sir. Please introduce once again and ask a question.
Yeah, hi, Dr. Jim. Thank you for a good presentation on leadership, and I'm a professor in a public university in Kingdom of Saudi Arabia based at Riyadh. And my quick question was for Dr. Jim about the authenticity. Like, what is the way, like, we see this buzzword on and off in today's scenario, and how to measure that, and like for as a professor of myself, like, what are the key performance indicators in finding authenticity? It becomes very subjective in terms. And the second it had been was that putting engagement somewhere in your this mosaic design, if somewhere could depict, would be also a good appealing for me. Like, that's where the two questions.
Okay, thank you. I think your first question was about authenticity. Is that right?
Yes.
Yes. And yeah, you're right. It's kind of a buzzword. It's been thrown around quite a bit. I think it's a good word though, because it captures these concepts of transparency, honesty, integrity, trust building, trustworthiness. And so I think these things are measured subjectively, and that's why the OLA has designed the way it is, that a leader doesn't assess themselves with the OLA, but the leader answers the questions, the middle managers answer the questions, and the workforce answer the same questions, and then you're able to see how they perceive the trustworthiness of the leaders and of the organization. Another interesting part of this is that this issue of trustworthiness and authenticity is not just the requirement of the leader, it's the requirement of the workers, the requirement of the managers. And so what you want is a healthy organization. And so part of the organizational leadership assessment, OLA, is that it encourages people to assess the organization. The very first item in the assessment is people in this organization trust each other. And then they measure that. And they measure that on a Likert scale, whether they do or don't. And then you're able to see the perceptions of the workers. And perception is reality. That's how people are perceiving the organization. And like we saw in those reports, that there's a perception gap. Top leaders do not really understand how their workforce is experienced in the organization. So I personally believe we need to do assessment. We need to ask the questions in a safe way where people can give their opinion, and that opinion can be averaged in with others and then reported in a safe way. As far as engagement, I do believe there's a good correlation between employees feeling engaged. The best measurement of this is job satisfaction. We've had probably 15 to 18 doctoral level studies done with the OLA and job satisfaction. And we know job satisfaction is correlated with engagement, with trust in all different areas of employee performance. And there's a clear correlation, strong correlation between the score on the OLA and job satisfaction.
Yeah, Dr. Jim, I think I could understand well. Thank you so much for the presentation. Thanks, Ali, for giving the opportunity once again. Thank you very much.
Thank you very much, Dr. Muhammad, for always being a regular attendee and asking questions. Now, let me move to the question box. We have a couple of questions already posted in the box. One from Brother Mahmoud Sharaf. Would you recommend that diagnosis to be made by one individual, HR director, or by each department head or supervisor?
Well, the OLA is an organizational assessment, so it's designed to assess the entire organization. And we are capable, too, of clearly identifying subgroups. So that could be departments and, or parts of the organization that they're geographically dispersed and that type of a thing. So I recommend that you assess the entire organization. Now, sometimes the organization isn't ready for that, but a particular subgroup, a particular department is. And so the OLA could be utilized to assess, just that organization. As an example, in our university, we have 9 different schools within the university. And my school of leadership is one of those schools, and we have arts and sciences and pharmacy and so forth. So we have assessed independently. We've never assessed the total university, but we have assessed parts of the university, School of Pharmacy, School of Leadership, admissions, and other departments. And the OLA is flexible that way. So it's really how you want to see the data. But generally, an organization will assess the total organization and then identify subgroups so that you can look at the data just by those people that are from that particular subgroup.
Okay, we have a supplementary question from Dr. Sharaf. Are these steps of diagnosis done on annual or continuous basis?
Great question. What we recommend is, of course, initially establishing a benchmark and do an initial assessment that would say, okay, we're a level 3 organization. And I'll give you an example of that. There's an organization here in my hometown that deals with senior living, older adults living situation, probably about 230 employees. And they did an OLA assessment back maybe 4 years ago, came up in Org 3. You remember that's negative parent. And they looked at that and said, well, that's not what we want to be. We want to be a more healthier organization. So they started to work on that. And then about a year later, maybe it was 18 months, they assessed it themselves. And they had been able to move up a whole level from an Org 3 to an Org 4. Now, that's still not an Org 5 where they'd love to be, but that's great progress. And the organization also improved in a number of very practical ways. Occupancy rates, which is critical for a residential facility like that. Several different business indicators had increased during that time frame. And so that was very, very positive. So we recommend setting a benchmark, setting a plan, and it can be based upon the 6 areas. We want to develop building community in our organization. We want to develop valuing people more. And you do implementation of those plans, which could be developed by workforce and managers and top leaders together or in specialized teams. And then reassess, probably in a year, maybe at the most a year and a half. and make this part of an organizational growth development plan. It's kind of like going to the doctor for an annual checkup and saying, okay, yeah, I'm doing pretty well, but we still have some things to work on. And then you can catch things as you go. A quick example of that is in the same organization, one of their subgroups, their maintenance team, had actually gone down from an Org 3 to an Org 2. And this put them in the toxic range, and they had some serious things to look at. Unfortunately, they didn't respond very quickly. They sort of said, well, yeah, that's just how that top leader is, and he's kind of a rough-edged kind of guy, but they really failed to address it, and it blew up a few months later on them, and they had a much bigger problem than they had earlier, and they have since addressed that. But the OLA really gives them a chance to identify problems that exist that you wouldn't know about unless you asked the questions and gave employees the opportunity to give their perceptions through the OLA.
Okay, thank you very much. We have another one from Farzahan. Marlene, the question is, how would you elevate an organization from level 4 to level 5, especially from leadership perspective?
Very, very good. And you're exactly right. You would start with the leaders on that. Level 4 is a good place to be. You remember, that's a positive paternalistic, positive parent. But you want to move beyond that. So one of the areas I would look at is that to train the leaders in this adult-to-adult way of communicating with their workers. You have to change your perception. We're so ingrained with the idea that leaders are sort of parental. You know, we're supposed to take care of, and we're supposed to guide the workers, which is true. But the servant healthier model, where we take on the role of an adult to give direction and support. You remember the model, the structural model shifts too. The top leaders are at the bottom supporting the managers. The managers support the workers. It's a support model versus an authority down model. Now we know that there'll always be an authority down model for certain decisions that need to be made. That's evident. But for day-to-day operations and how we work together, the support up model is much more positive. So I think it's training and coaching and getting people to think differently about what leadership really is. Leadership is about influencing people to become leaders themselves and to expand. So this creates opportunities for the leaders, and if the leaders start changing the culture, then you want to see that with the managers, you want to see it with the employees, and eventually you have a healthy organization. But it's hard work. It's very difficult work to create a change in culture, particularly with the changes required to go from an Org 4 to an Org 5, but it can be done.
Thank you. We have another one from Brother Muhammad Saif. The question is, how do you think OLA will integrate with cultural organization assessment?
Okay, I'm not too sure. Is that a specific assessment, cultural assessment that's being talked about, or are you generally looking at, does the OLA transcend cultures?
Well, Brother Saif, if you could specify exactly what the doctor asked, but Doctor, you may go with the general assumption.
Okay. Yeah, if we're not looking at a specific assessment, but that's an excellent question. The OLA was developed here in the United States and was originally tested with organizations in the United States, with one exception. We had an organization in the Netherlands that also participated. But since that time, we've seen the OLA used in multiple contexts. It's been used in Brazil, it's been used in the Netherlands, it's been used in Japan, the Philippines, a number of different places. It currently is available in multiple languages as far as the assessment. Of course, English. It's available in Spanish and Portuguese and French. But there's also, we had a study done in Saudi Arabia with a sports team where the OLA was sort of tweaked and adjusted to become an assessment for a healthy sports team, and that assessment was translated into Arabic. We do not have currently an Arabic translation of the OLA, as the main instrument, but that, of course, is possible to do. So we do believe that the concept of healthy organizations does transcend different cultures, though it will be differently interpreted, perhaps in different cultures, and that interpretation needs to happen within that culture.
Well, thank you. We have another one from Mr. Ronald and Ajeen. The question is, could you kindly share with us some of the tools that you've used to assess the health of the organizations?
Yes. Well, again, we have two tools here that are built off of the model that we've discussed today. The one is the OLA, Organizational Leadership Assessment. It's 66 items, takes about 15 minutes to complete, and it's delivered totally online. So it's a very convenient way to get assessment throughout the organization. We also have, and that assessment assesses the organization as a whole. It's an organizational assessment tool. The OLA 360 is based upon the same model, but it assesses an individual. This could be an individual employee for a performance review, or it could be assessing a leader in terms of their leadership performance. And the OLA 360 also is delivered online and produces a report that is then usable by the person being assessed. It has a multi-rater approach, again, online delivery system and all of that. So primarily those tools. Now the OLA has been correlated with other job satisfaction instruments, as well as the LMX. Some of you are familiar with the leader-member exchange instruments, and the OLA has been correlated with that particular instrument as well.
Okay, sir, we have a hand raised. Let me see. We have Brother Muhammad Saif. I believe you've already posted the question, but you've raised your hand, sir. So you have a different question?
Yes. Can you hear me?
Yes, sir, we can hear you. Could you please introduce and ask the question, and preferably a short one, sir, as we're pressed on time. Thank you very much.
Okay, my name is Muhammad Saif. I'm working for HP company. Okay, my question is here. Is this assessment, I mean, the result that you showed us during the presentation, is it based fully on surveying the leaderships, people, employees from within the organization, or is there any other way to conduct this assessment based on, instead of subjective factors, to be objective factors? Like, is there any solid evidence on based on which that we can say this organization is on level 4 or 5 or 6 or 1?
Well, it is a survey instrument, and that is how it's delivered. So people are asked to respond to the 66 items, and then their response is tabulated and averaged in, and then the report, you only saw 3 pages of the report. The report is actually about 20 plus pages, so there's a wealth of information that's given and provided for that. The instrument is highly reliable. Psychometric studies have been done on it, so it's a trustworthy instrument for measuring what it says it would measure, which is the model that we talked about today. Now, there can be supplemental things, supports for this, and this has been brought into certain research studies like interviews or focus groups, and sometimes that's an excellent way to follow up the results of the OLA, where focus groups can be brought together from the employees, the managers, and top leaders to ask more guided questions and collect more specific information that might be related to your organization. But the benefit of the OLA is that you seek to have everyone in the organization take it and get a very high percentage response rate. And this organization I mentioned that did senior living here, they had a over 90%, 94% response rate, which was pretty incredible. So they were able to look at the results and say, hey, this is what our people think. This is what they're experiencing. This is their perception. And so that becomes really valid information that top leaders need to pay attention to and accept, and then ask the follow-up questions how do we improve? Because the real issue is how do we improve? It's not, you know, what's wrong with us and point fingers and who's to blame. That's the bad response, the poor response to an instrument like this. The positive response is, okay, here's where we are. Now, here's where we want to go. How do we get there? How do we improve? And it's up to us to do that.
If you allow me to intervene here.
Sure.
Okay, we are still depending fully on interviewing people and getting their opinion, which is, if you are interviewing people, it will be highly subjective and biased. But my question here, is there any other techniques like auditing, like observing, without intervening or interacting with the organization people, the people in the organization, like auditing, like reviewing the communications, emails, communications, records? So this will be, I mean, for sure it will support the result of assessment, don't you think?
Well, I think it supplements it. It's another way to gather information. You can do a culture study through archive documents and that type of thing to understand an organization. Observation is an excellent way to do it. Now, all of these methods have bias built in and are subjective. And I personally feel like, you know, having an instrument, a valid and reliable instrument, is probably the most balanced approach to get information together, but then that should be supplemented by open, honest discussions about, okay, how do we improve? And again, everyone in the organization isn't going to experience it the same way. You might have some employees that see it as a 5. Hey, this is a great place, this is wonderful, and others that see it as a 3. This is a negative paternalistic. So the OLA presents an average response and a response by subgroup for departments and so forth that at least give you a starting point to say, okay, how can we improve? And if that's the emphasis, how do we improve, then that's a conversation you can always have. How can we build trust? How can we value people higher in this organization?
And there's a possibility to train the organization be able to conduct the survey themselves, okay? This is what reduce the bias, I mean.
Well, yeah, but the instrument, it exists and it's delivered online. It normally is implemented by the organization, but you know, people will go, will gain an access URL and access codes. They'll be able to go in and take the instrument, and then the instrument report is provided to the leaders. And then the follow-up is to facilitate a discussion around those results. But I think, you know, recognizing that there's bias in any type of investigation and exploration like this, the main thing is to limit that bias and try to get as healthy and clear information as you can. And that's why I personally think using a legitimate, reliable, and valid survey is a great starting point, because then we're not dependent upon you know, people with a bias themselves. You know, people that say, hey, this organization is bad, and let me tell you why. Well, that's just someone's opinion. Let's get everyone's opinion and put it together and see if it supports what that person says or presents something different. It might be more positive in this organization than what some of the naysayers are presenting in the hallway. So I think surveys are a way to get a clearer picture of what's going on. And I agree there's bias that's built into anything, but I think it's a less biased approach, less subjective approach to ask people directly and then to collect that data and provide it back into the organization and to start the discussion.
Thanks.
Thank you.
Well, thank you very much, Brother Saif, for your question. And folks, that really brings us towards the end of the webinar. I know there are a couple of questions still pending in the question box. I apologize because of the time constraints. We will not be able to continue with the Q&A. However, I request kindly do stay in touch with Dr. Jim Laub on the contact details which he has mentioned on the website, and we'll be happy to take further email from you, which we can direct directly to Dr. Jim Laub as well. With that note, also a lot of you have been asking about the soft copy of the presentation. Let me tell you that it's been already uploaded on Mile Community. We have shared the link on the webinar console. So Dr. Jim Laub, now I would really like to thank you on behalf of the Madinah Institute for Leadership and Entrepreneurship, Mile, for your time. Any concluding remarks that you would like to give before we dismiss out?
I just want to thank you for the opportunity, and the questions were excellent, very insightful, and I welcome contact. If anyone would like to follow up, you can go to the webpage, or my email is listed on the slide on the screen, and I'd be glad to send you a sample OLA report. You can go to the website and gain more information, but I'd be glad to interact with specific questions through email. So thank you again for the opportunity. Great to be with you, and thank you for letting me share.
Well, once again, thank you very much, sir, for your time, and thank you all of those who participated in this webinar. We are recording this webinar. The recorded version will be uploaded in the next couple of days, so please stay tuned to community.mile.org. With that note, I would like to end.
Madinah Institute for Leadership and Entrepreneurship, MILE.